Hi, my name is Cammie Evans. I am a stress management coach, but I am also a radiation therapist with over a decade of experience working with thousands of patients. I want to share with you some really powerful tools that will help make your radiation treatments hopefully a little bit easier. For a lot of people, you have to have a full bladder as you're going through this treatment. And so many of my patients say that that is the absolute hardest part of the entire process. And so I want to do a little video today to help bring down some of the stress related to that challenge. I have this cool tool and it's called EFT tapping. And what it is by tapping on acupuncture points, and I know this is weird, you're looking at me like I have four heads. By tapping on these points, you come to reduce the stress in your body, particularly when you think about something stressful. So I want you to trust the process and stay with me through the course of the video. I know there's probably going to be a little bit of resistance, and I want you to stay with me for just a minute, okay, as we go through this. We're going to start tapping on the side of our hand, and you can do either side. It doesn't matter. You can tap on either side, one side or both sides, alternating at the same time. It doesn't matter. However feels best for you is the way to do it. I'm going to stick with just one side. We're going to start by stating the truth of how we really feel. So even though having a full bladder is definitely the worst part of this process, right here, right now, I'm okay. Even though I hate this radiation therapy, but I know that it's for my best good. Even though this bladder thing and all of this awful water is the worst part of this entire experience, I'm going to just breathe and sit with my feelings for a few minutes. We are going to start tapping through the points, stating the truth of how we really feel. A full bladder. Ugh. It's so uncomfortable. I am so tired of this process already. A full bladder. I hate water. I really, really hate this. And I'm just being honest with myself. This has been really, really hard. Harder than I expected it to be. I didn't expect all of this water to be the worst part of the process. Maybe I'm lucky enough that I don't have to drink a bunch of water, but I still have to drink a bunch of liquid, and that is uncomfortable. So uncomfortable in my bladder. And it's hard to hold it. If you're feeling any sensations in your body, like maybe if you're a little nauseous at the thought of all that water, I want you to sit with that and recognize that maybe they're related. Or if your back hurts, or if you have any pain somewhere, just sitting with that and acknowledging the discomfort while you do the tapping. Full bladder. I'm so uncomfortable. So stop tapping for a minute. We're going to do another round, and this one is on a fear that a lot of people have. What if the worst thing happens? And I want you to think about, what is the worst thing for you? For a lot of people, it's having an accident. I've seen it many, many times, and I've seen so much guilt and shame, embarrassment associated with that. And believe me, we don't care. We feel bad for you guys because we know this is tough. But I want you to calm your nervous system and bring down some of those emotions for the guilt, the shame, the embarrassment that you may be feeling. If that has happened or if it does happen. Tapping works for both things in the past and worries in the future. So we're just going to lean into that for a minute. What if the worst thing happens? I would be so humiliated. What if the worst thing happened? So much shame and embarrassment. I don't want to feel this. I'm ready to quit now because this is really uncomfortable. And I want you to just sit with it. Keep tapping. You don't even need any more words. If you are really feeling that, just keep tapping. That's the important thing. Tuning into that discomfort in your body. Maybe you're a little bit nauseous because you're so ashamed. Maybe your back hurts. All of this shame. All of this embarrassment. I can't believe that happened. The worst thing happened. And I survived, but it was really humiliating. And I want you to think about that event. And what do you remember most about that event? Or what, if it's a future event or something that you're afraid of, what is it that you're afraid of? That worst thing. Get specific with what you see, hear, smell, taste, or touch. The worst thing has happened. Maybe it's a body sensation. Stay with that feeling as we calm our nervous system. I survived, but it was really embarrassing. I know they said they see this all the time, but it happened to me, and I'm really humiliated. Just keep tapping. We're going to do one more round just because this is such a difficult thing for people to deal with. I've had many patients break down because this happened. And I want you to feel my love and compassion for you because the worst thing happened to you. Just breathe in. Feel that shame. Can I release a little bit of this embarrassment? And if you can't, that's okay. And if you don't know how, that's okay. Just keep tapping. That's the important ingredient. Sitting with your emotions and feeling the emotions. I don't think I've done this one with you guys today, but this is just under the armpit, not in the armpit, but down a little bit. All of this shame. Now, if there's more that's coming up for you, you can repeat the video, but I want to keep these about 10 minutes long so that they're not prohibitively long. So please keep tapping. It does get easier. It does get better. And please reach out to your therapist. We have so much love and empathy and compassion for those of you that are going through this. And if I can do anything, give me suggestions for videos. I would love to help. Good luck with your treatments. I wish you the very best. Have a great day.